More kids ending up in hospitals has the state asking a question. Just how many ICU beds for kids do we have? Students quarantining due to COVID-19 scrambled school schedules last year, so schools have set out to make it intentionally hard to set off a quarantine this year. Colorado welcomes refugees. You proved it by raising $100,000 in less than a day to support the families coming here from Afghanistan. The weather this afternoon was less than welcoming. I think that storm's trying to tell us something. And trying to keep up with a climber who does it her way.
I don't wear high heels.
He doesn't. She does. Even on Colorado's highest peaks. The most Colorado thing we saw today. And it's next. Hi, welcome in. Politicians and public health officials have constantly moved the goalposts on us throughout the pandemic. I mean, remember the original reasoning for all the restrictions? To keep hospitals from overcrowding. Well, guess what? That conversation is back, now with a focus on kids. Kitty Eastman explains.
An unusual increase of kids in hospitals means the state will look into just how many ICU beds they have for them.
There are more children in ICU beds than we would normally see in August. And we believe it's important at the state for us to understand the capacity for ICU beds as we prepare for the fall.
The Hospital Association doesn't know how many pediatric ICU beds there are in Colorado. Children's Hospital doesn't have a single number either, because they say it constantly changes.
So, we have the ability to staff different beds in our hospital to ICU level.
Across children's state facilities, they've seen 60% more kids in ICU beds than they would see in a typical year around this time. An increase partly from COVID-19 patients, but more from kids with a respiratory virus called RSV that doctors normally see a spike in during the winter.
It's showing up now partly, we think, because people are starting to go out more. They're not wearing masks as much as they did last year.
In a normal year, doctors say emergency department volumes go up 30% when kids go back to school. And while doctors are worried about what that might look like this year, Children's says it's not concerned about capacity.
Even going into the fall, you don't think there will be a risk of overwhelming pediatric beds?
I don't think there's a risk right now of that happening. I think we are concerned and watching the numbers really closely.
For Next, I'm Katie Eastman.
The state actually just got back to Katie on those numbers a few minutes ago. And hospitals have checked in to say that they have a combined 58 pediatric medical surgical beds available and open, 113 newborn ICU beds open, and 25 pediatric ICU beds open statewide. Children's Hospital is asking all school districts to implement mask policies, saying that won't just help stop the flow of COVID-19, but could also help with RSV and the flu. The science, though, keeps getting thrown into the wood chipper of politics. Tri-County Health just recommended masks for school kids ages 2 to 11. Douglas County Schools, despite anger from anti-mask parents, have said that they're going to follow those mask guidelines. Today, the county's Republican commissioners voted to opt out of the mask rule for kids, even after their county attorney explained that doing this would basically just be political posturing.
The second part of the sentence goes ahead to explain that the school district, the child care, the private schools, just like any other business, they're still open to adopt this order as their own if they choose to do so. So essentially, next Monday, everyone will be in the same position they were last Monday. But we lack the power to prevent the school district, or a restaurant for that matter, from imposing its own mask regulation. Their house, their rules.
Well, perhaps the county commissioners were intending to put some pressure on Doco schools to drop their mask policy. We reached out to the district several times today to see if they're going to stick by their mask rule. We have not heard back. So before vaccines, last school year, you'd get one positive COVID case and it would send a class or several classes into remote learning, a quarantine. Not this year. The rules have been changed. The state health department is trying to minimize the quarantines that disrupt learning. Here's Victoria De Leon.
There are lower risk and higher risk situations.
The state health department issued new quarantine metrics for Colorado schools with one goal in mind.
To really try and increase the chance that our kids can stay in school and learn effectively.
Now, classroom exposures to COVID-19 won't always mean having to quarantine.
So when both parties, the individual that was infected and the individual that was exposed, were wearing a mask. Other settings like routine testing occurring, low case rates, and those types of scenarios, we do feel that quarantine would not be necessary at this point for routine classroom exposures.
But here's what's considered high risk: counties and schools with vaccination rates under 70%. And communities with high transmission rates over a 7-day period. Take Tri-County Health, for example. They oversee more than a dozen school districts within Douglas, Arapahoe, and Adams counties.
Unfortunately, the transmission rate in communities is high at this time, so that is concerning.
For now, Tri-County will follow the state's guidelines, but will implement stricter ones if there's a school outbreak of 5 or more related cases.
So at that point, we will require quarantine for students, even in the classroom setting.
And just like everything else with the pandemic, things can change quickly.
Even though kids may not get as sick, they still do get sick, and there have been hospitalizations and even deaths. So we're really taking that very seriously, but are dedicated to keeping kids in school as much as we can.
So the state's metrics to avoid quarantine based on school vaccination rates could get a little tricky. Now, some districts track staff vaccinations, but not many track how many of their students are vaccinated. Tri-County says the best data they have is county-based vaccinations in the school-aged children. But again, who knows what schools they go to?
Yeah, and Victoria, there might be individual school kids that have specific risk factors that their peers don't, but we know that in general, young kids don't tend to have serious cases.
Yeah, that's exactly right. And I spoke to an immunology doctor with CU Anschutz who says even with the Delta variants, kids remain at low risk. Now, not no risk, but the risk is still very low. And for those too young to get a vaccine, he says it's really up to those who are eligible to help protect the kids who are not.
Victoria De Leon, thank you very much. The breakthrough COVID case rate in the U.S. Senate is 4 times the national average. Colorado Senator John Hickenlooper is the latest to come down with COVID. Democrat says he's isolating, mild symptoms, said he was grateful to be vaccinated and not feeling any worse. That is 4 breakthrough cases in the U.S. Senate out of 100 senators. At the end of July, nationwide, there were about 125,000 breakthrough cases in the more than 164 million people who have been fully vaccinated. So repeat that again. The breakthrough case rate, getting COVID after getting vaccinated, 0.08%. So there's an app that will tell us if we have come across someone with the virus, so you know that you should go and get tested to be safe. The state of Colorado announced today that they are trying to simplify that process, make the app work better by letting people enter positive test results themselves instead of waiting on a code from the state health department. The whole code thing didn't work. 9 Wants to Know found that codes were going into the app 8% of the time. We wondered, though, now that people can enter their own positive COVID test results, basically the honor system, what's to stop somebody from spamming their friends, neighbors, and coworkers with fake case reports? The state says that users will have to pledge to tell the truth, and they have a system to stop repeat offenders.
There's actually controls within the national service for how those keys are anonymously maintained, which prevent a user from repeatedly trying to inaccurately activate an exposure notification.
So it sounds like a troublemaker can do it once. The state has spent quite a bit of money on this app, at least $875,000 on marketing and payroll. The state health department insists that the app is worth it because lives can be saved if somebody gets tested or isolates because of an alert. So usually around here, we wait until Friday to tell you how much Next viewers have raised through their Word of Thanks micro-giving campaign, but I couldn't wait because you've put together $106,000 and counting for Afghan refugee families that will be resettled in Colorado. We know those families are coming because Denver's been a top 4 destination for Afghan refugees in recent years. The African Community Center is the longtime nonprofit that will meet those families at the airport, take them to go find an apartment and then jobs and then schools. They'll help with translation and cultural orientation. If you would like to help with that nonprofit handling the incoming influx of our new neighbors coming from Afghanistan, text THANKS to 303-871-1491. $106,000 overnight from the viewers of some random TV show that the reputation truly is well deserved. Coloradans welcome refugees. Thank you. A few Next viewers have asked if incoming refugees are vaccinated. I assume you're not trolling, that you're genuinely concerned for their health. It's so we found you an answer. Hiking like a woman, standing a little taller on the summit when you're in heels. And today's storm provided a chance to bird watch on the radar. That's rude. Next. Poor I-70's back on the struggle bus. Just a few days after reopening from weeks of closures, interstate shut down again between Glenwood Springs and Dot Cerro has been for more than 24 hours due to the threat of rain and mudslides. One lane each way was opened up through Glenwood Canyon Saturday after just the devastating string of mudslides and flash flooding. When rain moved over the area on Wednesday, CDOT preemptively closed it down again. At this point, despite the rain up there, no mudslides or new damage has been reported. CDOT says the area is under a weather watch until midnight tonight, so it stands to reason I-70 is going to stay closed through at least Friday morning. I'm starting to get the feeling that Mother Nature has had it with us and our behavior. I don't know. You tell me what you see in the radar of this afternoon storm. Yeah, that's Mother Nature giving us the old single finger salute. Next viewer named David spotted it before we did.
Sunshine and 83 degrees before a cool front moved in. Look at this system. It's got some cold air with it, and for some areas that will mean snow late tonight, way up high, around 11,000 feet. Severe thunderstorm watch for Denver and northeastern Colorado through 8 o'clock. Tornado watch for extreme eastern Colorado until midnight. Storms tracking from the southwest toward the northeast. 1-inch diameter hail, a lot of lightning, and heavy rainfall. Some of these storms crossing I-76 are showing signs of rotation. We are expecting additional development overnight, along with that colder air and the snow around 10,000 feet. Once the showers move through mid-morning tomorrow, we're on our way to a beautiful Friday. Sunshine with better air quality and cooler temperatures. How about that? 82 tomorrow, 84 on Saturday, sunshine and 90s for Sunday and Monday.
Tonight's next question comes to us from Ken in Centennial.
My question is, with regard to the refugees from Afghanistan coming into Colorado and the rest of the United States, are they all vaccinated?
Now, Ken, I can tell, is asking out of genuine concern for the health of refugee families. I can also tell you a number of people have asked us similar questions with the clear connotation that they're just fishing for an excuse to turn away refugees. Here's what we know. The State Department just recently implemented a humanitarian waiver of COVID testings so they can get evacuees onto planes in Kabul before they're killed. That's just the start of the process, though, before someone comes here. Here's what we know about medical care for refugees after that point. The Colorado Department of Human Services says, in general, all refugees must undergo a medical screening that includes COVID testing before they arrive in the U.S. Then all attempts are made to give them presumptive treatment, which would include vaccinations. The state also works to give refugees a medical screening after they arrive in Colorado as well. Bottom line, State Department and the CDC for decades have worked to get medical treatment, including vaccinations, preemptively to refugees coming into the U.S. if that's not something that they could receive in their home country. Keep your questions coming. Record a video or audio message of anything you're wondering about with a tie to Colorado and email it to next@9news.com. As we always say, if you're wondering, somebody else is too. We'll try to find you an answer. Dressing up for a night out and hiking a 14er instead.
I think it shows that being like feminine and like outdoorsy are not mutually exclusive.
The most Colorado thing we saw today. Next. A young woman from Thornton climbing Gray's Peak is the most Colorado thing we saw today because she has some unusual climbing gear. Our photojournalist Mike Grady tagged along to learn about her approach.
It's like a runway.
Poor kid girl, your little runway thing.
My name is Erin and I climb mountains right now.
I'm climbing with my friend Erin. She is a beast, climbing in 14ers and heels.
These are some strappy kitten heels from Target.
The girl in high heels? Yeah, like why? Just why the high heels?
Well, I finished all the 14ers the end of last summer, and as a means of celebration, I figured I'd get all dressed up and repeat Albert, which was the first one that I ever did. And so naturally, if I'm gonna dress up, I gotta wear heels as well.
Wow, that is kind of crazy.
I had fun doing that and realized it wasn't as hard as it seems, and I've just repeated a bunch now in heels. We are headed right up there. That is the summit of Gray's Peak. I think it shows that being like feminine and like outdoorsy are not mutually exclusive. Like an actual, like legit outdoor brand will design a pair of hiking heels.
Yes, that'll be good. We've encountered a lot of looks, even without heels, before heels. When you see women in like spandex on a mountain, women in makeup on a mountain.
Feel like you need to strap your big girl pants on. Oh yeah, this is our first 14er. I honestly can't imagine that chick's gonna be in heels doing that. We were like losing our footing, like just. You look so fine.
Oh, thank you.
What are you doing up here? You come out here and you don't really know what to expect of this thing. Is it gonna be just me and my friend sucking air and trying to get through it, crying? Are we gonna be like on our knees, like not getting to the top? Or are we gonna meet some like super rad chick in a dress and heels that's like inspiring, that makes us wanna keep hiking more and see what else we're capable of? Like, doesn't get better than that.
Give me a hug. I'll transfer some of my oxygen over to you for the top.
I think it sends a message. These mountains are for everyone, like whoever you are.
It's actually not as bad as it seems, and I tell people that and they're like, you're crazy, but they do give you some leverage on the way up. Well, now I do think it would be cool to finish them all in heels, kind of get a classic sign.
Yes.
Women are badass. Like
She's going to do something bigger. This is just the start of her journey, and there's going to be some big things in her life for her, and I'm pretty excited for that for her.
Leverage on the way up, but Erin says she does carry trail running sneakers to change into for the way down. She's focused on climbing the 100 highest peaks in Colorado, not all in heels. There'd be some significant danger on a number of them. She says if she ever gets tired, she'll, head to law school between her trips to the mountains. We finish, as always, with your feedback next. More feedback tonight from folks who are concerned that there might be refugees coming in from Afghanistan unvaccinated. Gave this some thoughts. I'm going to draw a Venn diagram for you of the people who are concerned about unvaccinated Afghan refugees who also complain and fight COVID restrictions here at home. That's it. That's the Venn diagram. Diane says, let's welcome these refugees with love and acceptance. Can you imagine a life where you have to leave everything behind to come to a new country? I cannot, Diane. I would guess that my immigrant ancestors probably could, and perhaps yours too. Wonder what they would think of us. See you next time.